Meningitis is a disease that causes inflammation in the meninges. The meninges are the three protective layers that surround the brain and spinal cord. The outermost layer is the dura mater, the middle layer the arachnoid mater, and the innermost the pia mater. Meningitis is commonly caused by a bacterial or viral infection. Rarely, this disease can also be caused by fungal infection, parasitic infection, trauma to the head, or non-infectious conditions like cancer. Typically, the effects of the person depend on the severity of the disease. Symptoms of meningitis differ slightly depending on the person's age and type of infection. For pediatric symptoms include fever, pale, blotchy skin color, excessive crying, refusal to eat, vomiting, difficulty waking up, and bulging or swollen fontanelle. For adults, symptoms include fever, severe headache, nausea, vomiting, stiff neck, sensitivity to light, confusion, and weakness. Bacterial meningitis severe complications can include hearing or vision loss, speech issues, seizures, brain damage due to intracranial pressure, coma, and cognitive deficits. Meningitis is best diagnosed by obtaining cerebral spinal fluid sample from a lumbar puncture. On the image to the left, we see the needle go into the spinal canal, typically below level L2, which is the level of the conus medullaris. The collected CSF is sent to the lab to determine the cause to properly treat it. For the images on the right, we see an MRI scan to identify meningitis. We see leptomeningeal enhancement, which allows us to see contrast along the brain surface. We look for abnormal brightness and size, which indicates swelling or fluid buildup, which is where the arrows are pointing to. The prognosis of meningitis is dependent on the type of infection. The two most common types of meningitis are viral and bacterial. Viral meningitis typically resolves itself, but antibiotics and antivirals can be administered for more severe symptoms. For bacterial meningitis, intravenous antibiotics are administered to reduce complications as well as corticosteroids to reduce inflammation. Medication is likely to change depending on the type of bacteria that caused the disease. The hospital may also administer precautionary medications like anticonvulsant drugs to prevent the likelihood of seizures. In summary, meningitis is the inflammation of the meninges that is mainly caused by a bacteria or virus. Fungal and parasitic and non-infectious conditions can also cause a disease. This disease primarily affects the brain and spinal cord's protective layer. Symptoms are similar, but meningitis caused by bacteria is more severe and dangerous. Diagnosis is relied on a lumbar puncture with either a CT or MRI scan to support diagnosis. Treatment is dependent on the cause of the disease with good prognosis if the treatment and detection is made early to avoid serious complications.